Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today we are joined by County Executive Armin Budish, Board of Health Commissioner Terry Allen, and Board of Health Director of Environmental Health Rick Novickis. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish. Thank you.
Thank you, Devin. Good afternoon, everybody. When we do these briefings, I like to start by thanking Commissioner Terry Allen and his team for keeping us safe during the pandemic. And while things are getting much better, people are still getting sick, people are still dying, and the work of the Board of Health still goes on. Today, I want to talk to you about the $240 million that the county's getting from the federal government under the American Rescue Plan Act, or ARPA. First, let's look back to last year. We received CARES funding, which we spent to keep families in their homes, keep businesses afloat, and protect our essential workers and first responders. Through this funding, we distributed over 17 million units of personal protective equipment. We allocated over $11 million to small businesses and restaurants and gave nearly $30 million to renters facing eviction. These funds helped us make a tremendous impact. But we know that there's still lots more to do. We know that while the effects of the pandemic have lessened, many residents are still facing incredible hardships. Many of you are still in need of rental or mortgage assistance, support for your small business, and help just putting food on the table, and the list can go on and on. Today, I'm asking for your help. We've created a spot on our website that allows you to submit your ideas on how the county should spend its ARPA funds. This round of funding is a little different from last year's CARES Act. We can still spend the funds to support public health responses or negative economic impacts which result from the pandemic. But we now have a little more flexibility. Think about how we might use some of this money to create a transformative initiative that could have benefits to the county long after the pandemic is over. I want you to be creative. The opportunity is there. It's a once-in-a-lifetime chance. And we want you to be an active part of this process. We cannot create lasting change and enhance people's quality of life if we don't hear the voices of our residents. You can submit your ideas on our county website by visiting cuyahogacounty.us/COVID funding. It's on your screen. I look forward to hearing your ideas and working with my department heads to make them a reality. Next, I'd like to tell you about some steps we're taking to help businesses, especially small businesses, to get work from the county. The pandemic highlighted long-standing economic disparities that are harming small businesses, particularly those owned by people of color. One reason small minority-owned businesses have had trouble getting county business is that they have not had time to put together their bid proposals. So to help, our new Department of Equity and Inclusion has compiled and posted a forecast of purchasing and contracting opportunities for all our departments under the executive. The forecast was posted on our website on July 1st and covers the upcoming 24-month period. So that's July 1, 2021 through June 30, 2023. This enhances competition by helping vendors learn about potential contracting opportunities earlier in the process. It also provides advance notice to enhance participation from small, minority, and/or women business enterprises. In the forecast, you can find a brief description of the goods or services being procured, the anticipated solicitation period, procurement methods, and how long these goods or services are needed. You can find the 24-month forecast by visiting cuyahogacounty.us/forecast. Again, on your screen. Part of the barrier to entry is the understanding of our process and what our needs are. This advance notice will promote increased opportunity and access for a more diverse range of contractors and vendors. And finally, I'd like to address one more initiative which clearly became needed during the pandemic, and that's internet access. The county's digital divide is one of the worst of the entire country. 19% of households in the county have no internet access. This is not something that we can tolerate. We know this is a problem, and we've been working to chip away at this issue since 2019. In September of that year, we partnered with nonprofit Digital C to provide low-cost internet service to residents in the Fairfax neighborhood. Over 800 residents used this service. Then the pandemic hit. The virus quickly brought to light clear disparities in access to the computers and internet needed for remote learning. Kids needed laptops and the internet just to do their homework. To keep students connected, we donated 300 hotspots to Cleveland school kids without internet access, and we called on local businesses to donate computers and other unused equipment. And it's not just kids who need internet access. COVID put many people out of work. Thousands of people lost their jobs, and with many offices closed, residents were forced to apply for jobs solely online. So in partnership with Ohio Means Jobs, the county hosted a series of virtual job fairs to connect job seekers with local employers. Over 4,500 people participated in these job fairs, and on top of that, we provided 3 months of internet access for free for up to 1,000 eligible job seekers. This made it easy for job seekers to hop on the computer and speak with recruiters to help them get employment. Through last summer and into this year, we continued getting residents connected. Along with the Cleveland Foundation and T-Mobile, we created the Greater Cleveland Digital Equity Fund, which helped us provide 5,000 internet hotspots, 2 years' worth of unlimited data, and up to 10,000 laptops to families with a K-12 student in the home. As you can see, we've been working hard to get people connected through all sorts of strategies and partnerships. These have been effective in increasing the number of residents with internet access, but there's much more that needs to be done. We need something long-term, something that's sustainable. I'm excited to announce that today we've released an RFP asking businesses to find solutions and partnerships to expand affordable, high-speed broadband services to those lacking internet service. These solutions and partnerships will come with a targeted approach. Projects will be launched based on 3 separate tiers coordinating with census tracts. As you can see from the map on your screen, there are some areas of the county that contain fewer residents with internet access than others. Through this tiered approach, projects can be prioritized to more efficiently provide high numbers of residents with internet access. Projects could include new products and pricing, or new service options with discounted rates. It could also be investments into infrastructure that allow for lower pricing. We know the ideas are out there, and we want them here in Cuyahoga County. We've seen this targeted approach work in East Cleveland. In April, we contributed $150,000 to provide high-speed, low-cost internet access for 1,000 East Cleveland residents. It took just a few months for this to turn from just an idea into reality. What's great is that through partnerships with groups like PCs for People, Microsoft, and GE Lighting, this was able to come together very quickly. We learned that this can be easily expanded and replicated. The digital inclusion RFP will be open until September 6th of this year and can be found on the county website. Providing equal and affordable access to broadband is essential to promoting equal opportunity in business, education, employment, healthcare, and all other aspects of day-to-day life. I look forward to the submissions. We can receive them both locally and nationally so that we can get more residents connected. That's the goal. Thank you. And now I'll turn it over to Terry.
Thank you, as always, Executive Butis, for your support throughout the pandemic. We're certainly very happy that case numbers are low. It's certainly better than it was certainly in our worst days in last spring and into the winter, even some parts of the early spring here. So things are better. We are seeing less than a 1% positivity among all those that are being tested in the community. And that's certainly a very, very positive note at this time. Case numbers continue to be low. So we're enjoying this reprieve here this summer and hope that we're through the worst of it. Certainly the fall may bring additional cases, and we'll be working and reporting going forward based on new data that emerges. We thought today would be a great opportunity to talk with you on a range of environmental public health issues that relate to COVID and other seasonal issues, certainly from summertime and recreation activities. So I'm happy today to introduce our Director of Environmental Public Health, Rick Novickis. Rick is a longtime veteran here at the Health Department. He's been integral in the leadership of our response to the COVID pandemic. Rick led all the guidance, digestion, and all the orders and information interpretation that came from the state. He has wonderful long-term relationships with all of our communities, and also was a point person in convening the school districts throughout the pandemic. Every week when we talk with the districts on the range of challenges that they were facing to help them address COVID within their school systems, among their staff and their students. And so Rick is going to begin today to talk with us a bit about summer camps and COVID. And he would then transition in a bit to Tom Fink, a supervisor in environmental health, who Rick will get into and describe. But Tom also was very integral in the COVID response, working within our points of dispensing in a real operations and logistics role to assure that things ran smoothly as we all took on additional loads and additional jobs in the response. So with that, I'll be transitioning now to our Director of Environmental Public Health, Rick Novickis.
Good afternoon, and thanks, Terry. The staff in the Environmental Public Health Service area has conducted a wide variety of activities throughout our COVID-19 response. A lot of challenges, a lot of things to overcome, a lot of learning on a daily basis, that's for sure, and they did an incredible job. Some of the activities really involved working very closely with our community leaders, school superintendents, business owners, and event coordinators. They responded to hundreds and hundreds of complaints and spent a great deal of time working with individual owners and employees and businesses, retail stores, restaurants, to provide guidance on how these facilities could stay open and viable while still remaining in compliance with all the state orders and the safety protocols, which was always frequently a challenge, but they did an incredible job. And our business owners did an incredible job as well, trying to stay viable and do a great job serving the public as much as they could in a safe manner. Now that these orders are no longer in place, it's important to remember that we're still not completely out of the woods, as Terry mentioned. We continue to receive notification of COVID cases on a daily basis and work closely with facilities that may be experiencing small clusters of more than one case. COVID-19 hasn't disappeared from our county, our state, or any of the nations around the globe, where we see high elevated numbers of cases still going on today. The best way to make sure that we keep heading in the right direction is to get everyone vaccinated. This is the perfect time to get younger individuals that are 12 years old or older vaccinated so that we can safely return everyone back to school this fall, keep our students safe, our hardworking teachers and administrators safe, and get them back in a way that minimizes the potential for COVID transmission during schools, sports, and other extracurricular activities. We're also hopeful that sometime by fall, we may be able to get younger kids vaccinated as well, which will be very important as we head back into the fall classes. Activities like summer camps are often run by communities, churches, or schools, and they're a great way to continue kids' education, enhance their physical and social skills, and most importantly, let them have some fun. They definitely deserve it after all that they've been through as well. So with this in mind, the CDC recently updated their guidance for summer camps and similar programs. The guidance provides strategies that programs can use to plan and operate their camps while still maintaining a healthy environment and keeping the risk of COVID transmission as low as possible. Those who are fully vaccinated don't need to wear masks, especially when they're in an outdoor setting. However, masks still are very, very important and will help protect the unvaccinated and are strongly encouraged for folks doing activities, especially in an indoor setting. It's important to remember, though, that we all need to be respectful and supportive to those who choose to continue to wear a mask. We have some folks who are still going to be more comfortable, even after being fully vaccinated, wearing a mask, and that's absolutely okay. We also have a lot of folks who may not be able to receive the vaccine because of pre-existing medical conditions. So we have to be very sympathetic to these folks and make sure that we don't try to isolate them or act differently around them at all. It's very important that we continue that type of good humanitarian behavior and everyone get along moving into the fall. The CDC summer camp guidance will provide some physical distancing, like we talked about in schools, and like schools in the K through 12 setting did an incredible job throughout the year, trying to get kids educated as safely as possible while still trying to keep them as distant as much as they can and keep everybody protected. Campers can be assigned into smaller groups or cohorts that will remain together throughout the entire camp session. So basically, that would help minimize the number of those potentially exposed if somebody turned up COVID positive, especially if they weren't exhibiting any symptoms and didn't even know that they were COVID positive, which is very likely in children since kids are more likely to be asymptomatic and can spread the virus unknowingly to others. Summer camp organizers should continue to encourage those 12 years of age and older to get vaccinated and remind parents and guardians that's really, really important to make sure that if we have any kids that are exhibiting symptoms, that they stay home from camp. I know it's real easy to send them off to camp and off to work you go, but the reality is you may be doing quite a bit of harm unknowingly by having someone who has some symptoms go to potentially infect others and people who work diligently to keep everyone safe in summer camp. So it's important that parents are still monitoring their kids for symptoms as well and talking about the importance of that with their children. High-touch surfaces and shared objects should be routinely cleaned as always, and frequent hand washing and proper cough and sneeze etiquette should be promoted and reinforced at summer camps. In case an outbreak occurs, which may happen, camp administrators need to isolate those with symptoms, assist with contact tracing, recommend the proper people get tested as soon as possible, and quarantine anyone who may be unvaccinated that could have been a close contact. That's the first line of defense, is to have folks that are knowledgeable on how to respond accordingly in a timely fashion to help minimize the transmission of COVID. Ultimately, layering many of these prevention strategies helps reduce the spread of COVID and will definitely help protect those that are unvaccinated, because in many cases they're too young to be vaccinated, along with their families. All the details associated with summer camps and other type of recreation programs and prevention techniques are available on the CDC's website. So this time of year, the environmental folks typically provide guidance on things like picnic food safety, how to protect yourselves from getting bitten by mosquitoes, and how to safely swim and enjoy our local pools and beaches. Unfortunately, we've all heard recently a number of very unfortunate and very disappointing situations where we've had some folks accidentally drown here in our local bodies of waters, lakes, rivers, and smaller ponds. And it's a very unfortunate, and we work really diligently to try to get information out to folks to help prevent things like that from happening. So today we're going to have one of our supervisors, Tom Fink, who spent many years working in environmental public health, and he will provide some more guidance related to recreation and pool and beach safety.
Thanks, Rick. Like Rick said, I'm going to talk a little bit today about our recreation programs, specifically our beaches and our pools programs. As we all know, we all like to get outside, especially with the past year and a half that we've had. We really want to get out and start enjoying the weather, start getting with other people, getting together in groups. And our pools and beaches are great places to do this, especially with the shorter summers that we have. They could be a great place for us to go out, congregate, and enjoy some of the nice weather that we do have outside. One of our goals here at the Cuyahoga County Board of Health is to make sure that people are doing this safely. We work with operators for both our pools and our beaches to make sure that our beaches and pools are all operated in a way that is as safe as possible for all of the patrons from the county. Excuse me. So a couple things I really want to focus on while I'm talking here today. One is please never swim alone. One of the biggest safety issues that we see is people going out, whether it be in our natural bodies of water, our lakes, our rivers, our streams, or even in general swimming pools, and swimming alone. If something were to happen, you do want somebody else there that is available to either call 911, provide on-scene CPR or first aid, or something like that. So you never want to be in the body of water by yourself. Another thing is, if possible, please learn to swim. Learning to swim is one of the greatest things you could do to keep yourself safe. Unfortunately, drowning is a leading cause of death for young people across the country. Up to the age of 14, it is the second leading cause of unintentional injury death. So it is very important that you teach your children how to swim, whether you do it yourself or you find a local lesson. Any way you're able to get out there and get that taken care of is a life-saving ability for any child or any person, whether you're young or old. So a little bit about the programs that we do run here at the Cuyahoga County Board of Health. First is our swimming pools program. We license over 600 swimming pools here across the county. So we are out twice a year inspecting these pools, looking at everything from water quality to safety issues. A couple of things that you can look for yourself as the general public when you're out swimming. The one thing you could definitely look for is taking a look at the water quality itself. You might not be able to have it. You might not have a test kit handy where you can go out and test the actual chlorine or the other water or the other chemicals that are in the water to help keep you safe. But one thing you can do is observe how clear the water is. If the water is cloudy in any way, or if you can't see the bottom, it's a great idea not to get in the water. That's a good indication that there are some issues. One might be that there's low chlorine, so it's not actually treating the water correctly. But two, it might also be that that there's some other underlying factor with the pool that's not allowing it to work correctly. With cloudy water, the other major issue is you can't see the bottom of the pool. You can't see somebody down in the bottom. If there is an incident where someone, whether they can't swim or they have a medical emergency and happen to sink to the bottom of the pool, it is possible that that person could end up at the bottom of the pool for a significant amount of time before they are noticed if you can't see the bottom if it's too cloudy. So one thing you can see, or you can personally, as you go out to our pools, our local public pools, check the water quality to see if you can actually see the bottom of the water. It's probably the one thing that the most important thing you could do in regards to water quality for itself. Two, again, also though, I can't stress this enough, is learn how to swim, especially with pools that are a little bit deeper, whether it be a diving well or a pool that has a deeper end. Try to learn how to swim. Unfortunately, the majority of our drownings in our public swimming pools happen from somebody who didn't know how to swim and ended up in the deep end, whether they floated there in a raft or slipped under a safety line, whatever it may be. The person didn't know how to swim and ended up in the deep end and got in over their heads. So unfortunately, we have to follow up on all of those drownings and investigations, and those are probably the hardest part of my job. So I don't like doing them, obviously. So if we could prevent any of those from happening, it would greatly improve the quality of life of any young person throughout the county. So another thing I do want to stress, along with what Rick said, is if you're sick, stay home. And this just isn't just with our COVID-related illnesses. With recreational water, please don't go out swimming if you have any kind of gastrointestinal illness, or if you're exhibiting any kind of symptoms of diarrhea, vomiting, nausea, anything like that. Please don't go visit one of our local swimming pools. While our recreation water quality standards do a good job of maintaining water quality, we don't want to take the chance of you spreading that illness over to somebody else that might not have the protection that you have. So if you are sick, please stay home. And like I said, not just with those COVID-related symptoms, but any kind of symptom that might be associated with gastrointestinal illness as well. All of our inspection reports that we do write up can be found on our website at ccbh.net. If you search through the A to Z index, you'll see the links for the swimming pools program. All of the inspection reports can be found there. The other recreational water program that we house here in Environmental Public Health of the Cuyahoga County Board of Health is our beaches program. We permit and inspect and sample at numerous beaches throughout Cuyahoga County. These beaches include both Lake Erie beaches and our inland lakes. With these, we're out inspecting twice a year, but we're sampling more often than that. So our major public beaches, so here in Cuyahoga County, they're all run by the Cleveland Metro Parks. The ones that we are responsible here for in the Cuyahoga County Board of Health include Huntington Beach out in Bay Village and Wallace Lake in Berea. The other two major public beaches that we have on Lake Erie, Edgewater Beach and Villa Angela, are both in the city of Cleveland. Like I said, those are both managed by the Metro Parks, but are sampled and inspected by the Northeast Ohio Regional Sewer District. So when we go out to do our samples, we're taking a look at the water quality to see if it is safe for you to swim. By that, I mean if there's a good possibility when water quality advisories are posted that someone may get sick if they ingest the water. So what we do is we sample at our public beaches, so our major public beaches, the Huntington and Wallace, on a regular basis, multiple times a week. With Huntington, we're there 7 days a week. And our other local beaches, so our neighborhood beaches, community center beaches, that kind of stuff, we're sampling once or twice, a week or a couple times a month, depending on the usage of the beach. All of our results are posted on our website, again, ccbh.net. Another thing I need to stress with our beaches, especially with the recent news stories that we've had of the drownings, is please make sure you're swimming in designated swimming areas only. There's a reason that these swimming areas are put in place and that they are where they are. The contours of lakes, especially Lake Erie, change on a regular basis with the wave action that we see. So we don't know what's underneath the water at any given time. There could be a shelf that might fall off steeply very quickly. It could be other underwater hazards, whether it be old building materials with rebar sticking out, whatever it might be. So please stay out of any non-swimming areas. Swim only where their swimming area is marked. And if the beach is guarded, please only swim while the guards are present and actively watching the water. Can't stress that enough, that it's very, very important to make sure you're staying inside those swimming areas. Also, please be aware of current weather conditions. With our sampling that we do on a regular basis, the majority of our water quality advisories pop up after 24 to 48 hours after a major rainfall. So if there is a major rainfall, expect that the next day or two, there's going to be some water quality advisories where the water probably isn't safe to be in, just because you don't want to take the chance of ingesting any of that water. The reason for that is because of the sewer system that we have here in Cuyahoga County. You do see that we have some combined sewers, which basically means that the storm sewer and the sanitary sewer are on the same pipe. And when you get a heavy rainfall, some of that storm mixes with the sanitary and washes it out into the lake. Because of this, your bacteria count in the lake will rise, like I said, 24 to 48 hours after any major rainstorm. So please stay out of the water about 2 days after any kind of rainstorm, and also be aware of any current weather conditions. As we know, the weather can change pretty quickly here at this time of year. With it being so hot and humid, thunderstorms can pop up on a regular basis. Please be aware, whether you use a local app or the National Weather Service, whatever it might be, whenever an advisory is issued, please be aware and try to stay out of the water if possible. The National Weather Service on a regular basis issues what are called beach hazard warnings. These are posted on their website and then are also posted on other third-party apps, weather apps throughout any app store that you might find or use. These are issued anytime that weather conditions are ripe for rip currents or any kind of other dangerous hazards that might be found in a beach, and basically tell you to make sure you stay out of the water at that time. Again, like our pools, we want to make sure that you're staying home if you're sick. We're dealing with water that isn't treated like a pool, so it's not chlorinated. So there's a better possibility of passing something on to somebody if you're swimming close to someone while you're ill. Same thing goes with the non-COVID related illnesses, so the gastrointestinal illnesses as well. But if I could stress one thing, it would be to learn to swim, whether it be yourself as an adult, your children, your grandchildren, nieces, nephews, friends, whatever it might be. Get them enrolled in a swim class. Local swim classes are available throughout the county. There are some that are cost effective. I know some community centers offer them for free. Some have reduced rates for individuals. But if there's one thing I can stress is to go out and learn how to swim if possible. I'll turn it back over to the county.
Thank you all very much for your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. So with that, we can take a question. All right, going once, going twice. Okay, well, thank you all very much. That concludes this week's briefing. Thank you very much for joining us, and we will see you in a few weeks.
Hi,
Oh,
this is Lisa Ryan.
yes,
Can you hear me?
yes.
Sorry, I was having trouble. I'm sorry, Ryan from the meeting. And my question is, what is going to keep federal good from that? Is all of it going to go toward resident hospitals, or do you have any plans on any of it?
Lisa, I'm really sorry, you were breaking up pretty bad there, but I think you were talking about federal funding, and I didn't quite catch all of that. Do you mind trying to repeat your question?
Yeah, I'm so sorry about that. Are you able to hear me now?
A little bit better.
Yeah, sorry. I'm wondering how much money the county is going to receive from Arba.
Okay, great. Yeah, we could hear that.
So I guess that's to me, Terry. The county is receiving something around $239 million from the ARPA funds. And I'd also mention that there are other buckets of funds that are periodically becoming available under other parts of the legislation that was passed. For example, we've gotten some additional funds for rental assistance in addition to the 239. I should also mention that cities under ARPA, unlike the CARES Act, cities have gotten significant funding as well. So I believe the city of Cleveland got something in excess of $500 million, and most of the other cities have also received some significant funding. So there is a lot of federal money floating around out there right now.
And so how much of that will you use toward residents' proposals?
That depends on what the residents' proposals are. We are very generally looking at using some of the funds for budget losses, revenue losses that we've incurred, which is part of what the purpose of ARPA is. Part of it is to mitigate the continuing COVID crisis. So additional PPE, for example, additional adaptation to county buildings that the public comes into, those sorts of things. Some of the money will go for those. And then we hope to have funds to support, well, we will have funds to support things like additional small business supports, food supports, other things that we've done under CARES and that are still required. And then finally, we're looking at one or two, potentially more, but major long-term transformative initiatives that can last long beyond the one-time money that we receive, that can help improve the county and improve the lives of our residents longer than just today.
Thanks so much, Executive.
Thank you. Any other
Welcome.
questions from the media? All right. Well, thank you all very much. We'll see you in a few weeks, and have a great day. Thank you.
Thank you.